Hi, good afternoon, everyone. Welcome to our viewers of VOH, I think for yet another session of Wisdom Wednesday. We hope that this is a nice midweek kick to your work week that we can provide. In line with having very distinguished guests and interesting speakers, I'd love to introduce our speaker and our guest for today, which is Dr. Arjun Dang, who's CEO of Dr. Dang Labs. I'm sure most people who follow the diagnostics industry would know that Dr. Dang's lab is synonymous with quality and utmost repute, certainly in the North India region. And Dr. Arjun Dang is certainly been at sort of the forefront of that. So without further ado, I know we don't have a lot of time for this session, but I do want to hand this over to Dr. Arjun to basically speak about himself a bit more, and then certainly about the lab. So over to you, Dr. Arjun.
Thank you so much, Karthik, for your kind words. And also a big thank you to Voice of Healthcare for hosting me today. So certainly my introduction should include that I'm a pathologist by training. And I did my MD down south in Chennai, where I spent about 8 years for my MBBS and MD. Post that, I had the privilege of working in Indraprasth Apollo Hospital, where I trained further in histopathology. And post that, I always had a dream as a child to work in a government setup. So I managed to complete that when I did my SR-ship in Lady Hardinge Medical College for close to a year. And it was during my SR-ship that I got through to the fellowship in liver pathology in King's College Hospital in London. So I was there for close to 2 years. And it was only after that that I came back to Delhi and I took the decision of joining our company. And it's been close to 4 years now that I've been leading Dr. Dang's lab with the team that we have here. And certainly it does feel a lot more than 4 years, Karthik, if I'm frank with you, especially because of the last year that actually felt like a decade. And now that things are slowly normalizing and we're getting back to normal things again, it's actually a huge relief.
Thanks, Dr. Arjun. I always feel guilty when I get doctors to sessions like this because I know how busy their day is. Certainly over the last year and a half. And so, thank you for taking this time out. I know it's not easy. I'm guessing you're in the lab right now. You've probably had a long day. You probably have a few more hours of work ahead of you. So thank you for taking this time. Of course, I didn't get a chance to introduce myself, so let me do that as well. I work for Cephiep Diagnostics, which is a market leader for molecular diagnostics. And in many ways, we work with Dr. Dang's lab. It's also one of our very prestigious customers. So, more than this being a discussion between, panelists, I think this is also a discussion in terms of voice of customer for me, right? Really sort of getting into it, the topic that I think, we'd sort of mutually agreed upon today was how is the diagnostics industry changing with sort of the new policies, the best practices, some of the insights. And I think really over the last year and a half, right? I mean, I think many of us in healthcare kind of knew the importance of diagnostics, but over the last year and a half, it has really become sort of even the common man on the street knows the importance, right? How important it is to get the proper diagnostic, certainly for COVID, but also for other diseases. RT-PCR, my grandmother talks about RT-PCR now. Right. So it's really become commonplace in that sense. So in a way, to really kick this off, I know the past year and a half has been a whirlwind for you guys. In fact, for all private, diagnostic labs, including, of course, the government sector. But if you were to look back for the last year and a half, and, funnily enough, in Delhi, we're at the cusp of hopefully the second wave really ending, right? And that was almost a different sort of intensity, if you will, than the first wave. When you look back, what are some of the learnings, some of the best practices, or just some of the thoughts that you would have on the past year and a half?
Sure. So very relevant, Karthik. Now, the past 1 year has been nothing but a roller coaster ride for us. And when I actually look back at when we actually read in the news and saw on TV that there's this virus that's originated in China and now is spreading, and I'm being very frank, but the only place that I'd ever read about coronavirus was probably half a pager in my textbook in college. And all of us really didn't know much about the virus. Until
Mhm.
date, I would like to say that yes, our knowledge is still evolving on a daily basis, but we've definitely managed to learn a lot about the virus, the diagnosis, the treatment, the vaccination, how the virus is evolving, etc., and so on and so forth. But certainly,
Mhm.
the last 1 year has led to a lot of gain of knowledge also and wisdom also. And also, when I look back and I think that what were the few things that actually helped us combat and also scale up for COVID-19 RT-PCR testing, certainly what comes to mind is the swine flu pandemic that was close to a decade back. And it was because of that swine flu pandemic that we managed to have so many BSL-2 facilities and so many RT-PCR facilities in India. Now, also
Mhm.
looking at back at that pandemic, at that time when H1N1 had hit us, I still remember we had absolutely hardly any facilities of BSL-2 and RT-PCR labs in India. So that's why
Right.
if you see how the graph increased substantially of setting up labs, it was not only because of the existing lab infrastructure that was there, but also the knowledge base and the pool of expert people who knew how to
Mhm.
run these samples. So firstly, when we started testing, and finally once the government allowed the private players, we were all in a fix about not only how to do the testing, although that was the simpler part of it, but also on how to train our staff members to collect the samples. And obviously, if there's a technician who's going from home to home collecting COVID samples, there are numerous things that you have to keep in mind, because the people also are extremely apprehensive. Even the
Mhm.
people's neighbors on the other side, when there's someone in a PP at the door, there
Right.
used to be a huge ruckus, and we had to take care of multiple things there. Now, that
Mhm.
that was when one day I thought that why not, instead of sending the same person door to door, have people come to you. But then if you have people come to you, obviously we have a lot of walk-in RT-PCR centers also. But my
Mhm.
apprehension always was that if you have people queuing up and giving swab after swab, you're obviously
Mhm.
increasing the chances of transmission. That was
Right.
how the idea of the drive-throughs originated. And I still
Mhm.
remember that Delhi was in complete lockdown, and we decided to open our first drive-through center. And we had
Mhm.
a lot of challenges, even for simple things like making signages on the road. My team could not find a printer, like a commercial printer to print a banner. So, from very,
Wow.
very small things, from writing the SOP to actually having my in house team make a cabin where we can have staff in their PP collect the sample, and also getting the online booking in place. So everything was a lot of innovation also. And obviously we took inspiration from the West and learned from them, because this model was also very prevalent in Korea and in South Korea and the US. But then this
Right.
was just one of the many granules that we picked up from our learnings. Apart from this, also as the pandemic evolved, we were also made to reduce the prices, make it more
Mhm.
affordable. And
Right.
obviously, with made in India products coming in, with PPs being manufactured here, with kits also becoming more affordable, we wanted
Mhm.
to give that benefit to the patients as well. Obviously, there was capping of the RT-PCR test that was also correctly done as the prices had come down. And we
Mhm.
also had to modulate all our processes and our efficiencies in a way to increase capacity. Now, this is a very common question that private players are asked, and I've answered these multiple times. Is that, doc, that why can't you increase your capacity? Take a week, take five more machines, and you have no
Mhm.
shortage of funds, and increase your capacity. But what I always want to tell people, and even other labs and chain labs and corporate chain labs who've significantly scaled capacity with the COVID RT-PCR testing, is that you have to do it in a very calibrated way. So if you were
Mhm.
earlier performing 100 tests a day and now want to perform 10,000 tests in a day, it's absolutely possible if you have the right infrastructure and the manpower in place. But then what is very, very important is to do justice to the turnaround time. Now,
Mhm.
increasing samples and increasing your sample collection ability and coding samples is certainly not what I wanted to do. Even in the
Mhm.
second surge, my only regret was that I wasn't being able to accommodate as many people who I would like to. But at the
Mhm.
same time, with a heavy heart, I made a very conscious decision that I'm only going to collect those many samples that I can dole out the reports in 24 hours and not a minute more. Because as
Mhm.
soon as you take 48 hours and 72 hours, you're not really doing justice to the patient, because he's symptomatic and he's obviously spreading the infection everywhere. Apart from
Right.
this, also increasing capacity comes with a very important concept of obviously not compromising on quality also. So you
Right.
have your double checks in place, you have a very sturdy SOP that is followed, and so on and so forth. So these were the learnings through the year, and obviously the second surge that was there, I just hope that nothing like it ever comes again, because that was actually the time that I actually saw with my own eyes various healthcare industries, various setups actually crumbling. Because
Mhm.
when half of the city was anyway infected by COVID, it was very challenging actually to function with three times the demand and half the staff in place. So
Right.
certainly I'm glad that is behind us. And but definitely a lot of learning, a lot of new concepts, a lot of things that we learned in processes also, apart from just
Mhm.
the analytical phase, also the pre-analytical phase, also the post-analytical phase. I don't think we've ever performed any testing that has
Mhm.
such a demanding post-analytical phase, with your data entry, the data entry processes, the reporting to the government also, and so many other things in place, that it was very interesting for us actually to learn it. And now there is a system in place, and may God forbid that there is a third wave, we will be very well prepared.
Thanks, Dr. Arjun. Yeah, I can only about imagine because we get to hear part of the story, but you're really in the thick of things, right? And you spoke about the sort of the data entry, and it's all for good reason. And ICMR is running a really good program with all the data they're getting, but somebody has to enter it, right? And the quantum of patients you would be getting, I'm sure that was not an easy task, right?
So
I please go ahead.
yes, so Karthik, another major learning that we took out of this, and probably in big bold capital letters, is that we actually realized that automation is the only way forward. When
Okay.
even during the second wave, even when we had half the staff, we were still able to, or a shortage of staff, if I might say, it was
Mhm.
only the automation that we had, our back-end CRM that was getting the bookings, our LIS that was very thorough from step one to the last step, and also the automation inside the mall bio lab that really
Mhm.
helped us pull through. Because in case we didn't have an automated extractor, and in case we didn't have a CRM taking bookings and instead people sitting and taking the bookings, I don't think we would have been able to handle those kind of loads. So a major learning even for standalone labs and even for smaller startup labs is that try and embrace automation, try and use technology to the maximum effect, because you
Mhm.
really don't know when your staff is going to be ill and you are going to be short on manpower.
Yeah, no, thank you. I think that's really helpful input. I know automation and digitization has been happening, but maybe this sort of pandemic really kind of is a further catalyst to that process, right? Automating lab workflows. Before one thing that I have seen, and I talked a little bit about how RT-PCR became commonplace, right? My grandmother started talking about it, right? But then at the same time, we also know that there was a lot of misinformation around what a test value means, or not all tests are created equal, right? Even within RT-PCR, you have many different kinds of tests. And then, especially in the second wave, we also saw the ancillary tests that were being done, right? D-dimer tests and things like that. And I know that Dr. Dang's lab is one of those labs that has a very close touch with their patients, right? Because traditionally you've had so many walk-ins that come in, right? So is there something you had to do specially on educating patients on, okay, what does this test mean? Or why are you getting this test instead of this test, right? Because typically this would be something that the clinician does, but we know that clinicians had no time. They were seeing 200 patients a day. So was that something you guys had to do as an extra?
So certainly, Karthik, if you remember, WHO before calling this a pandemic actually called this an infodemic, because in the stage that we are in, with so much information on social media, on the news, and everywhere, people are just overwhelmed with that information, and actually getting the correct facts is half the battle won. Now there was one particular thing that I've told many people. I've said it on various channels and discussions and forums as well. Is the timing of the test. Again, when there's someone who's had exposure to someone who's tested positive, you cannot panic and jump in for an RT-PCR test, because if you're within that window period of the virus, that is in less than 5 to 7 days, and you get tested, it actually has two adverse side effects. The first one, obviously, is that you get a negative report, and when you can actually turn positive in a few days. And the second is also that false sense of security, that you feel happy that I don't have COVID, and then you're meeting people and not
Right.
following that extra safe precautions that you should. So certainly creating awareness was the need of the hour. And also what I felt, and actually we implemented very effectively, was that I personally, along with my infection control team and HOD of molecular biology, we trained our entire field staff on our own, in a way that our entire field staff was broken up into a group of 5 people each. We did about 10 training sessions, and after those training sessions, Karthik, we assessed each and every one of the technicians who was actually going home to collect samples. Now the assessment, obviously, we made sure that they knew how to collect the sample properly, but also that it was a timed assessment. So to collect one COVID-19 RT-PCR sample, including ringing the bell of the person, or if they're calling them, reaching the doorstep, wearing the PPE, spraying where they've kept their PPE, to taking the sample, labeling the VTM, packing the sample, filling whatever is required, the labeling, etc. It all has to be done during a time duration. Because the more time that the technician spends with the patient, obviously they are more exposed to the infection also. And apart from that,
Right.
also with the technicians, we had a very robust training program where we told them about the infection, about the timing of the test, what an RT-PCR meant, what is a CT score, when does the antibody actually come. Because Karthik, we realize that no matter how many customer care lines we have, the technician is the one who's going to the house. He'll be
Right.
the one who's interacting with the patient the most. So we found those spokes to our wheel, where I thought that the more we train them and the more that they learn about the infection and the testing protocol, it'll really reach out to the patients very effectively. Another major thing that we really saw during the second surge, and you just mentioned also, was that I had hordes of people coming to the lab and calling up our customer care also, and asking that, oh, we've heard that there is a blood test that detects COVID-19. Can we get that blood test done? So
Right.
again, just these four basic tests. So CRP, ferritin, IL-6, D-dimer. So my entire staff, I would even say my housekeeping staff, probably knows by now what these tests are for, and
Right.
that you cannot diagnose COVID-19 by a blood sample. The gold standard obviously remains to be RT-PCR. So these few things were again and again completely clarified to everyone, so that anyone and everyone reaching out to us can get the correct information.
Thanks. That's a really telling thing you said there. That in the end, it was the collection. The phlebotomists or the people that were going to see patients. They were the ones engaging with patients, right? And they would be the ones answering those questions. So I think that's a really interesting approach. We talk about it in public health all the time, sort of democratizing information. Really having some of the work that clinicians or nurses don't need to do, right? Some of the other folks can do it. So really interesting. I think you touched about it a little bit, but I think Dr. Dang's lab is also a very good sort of institution to ask this next question to, right? And it really the question is around what role do you see sort of private sector healthcare institutions, in your case, a diagnostic laboratory, sort of playing in public health activities, right? And I think India is obviously a very pertinent country to ask that question for, because various studies have been done that say more than 50% of people seek healthcare in the private sector. Our GDP spend figures kind of tell that out very, very, very clearly. But I also know that your institution and your father has been involved in a lot of policy making. He's been sort of a public face, including some of the previous public health projects that we've done. So maybe you have sort of an insider's view, right, into how you see sort of playing that role and filling a gap, because there is a gap, right?
Certainly. So Karthik, with a country as big as India and the kind of density of population that we also have, if
Mhm.
we need to even move towards providing quality, affordable, and accessible healthcare to all the citizens of the country, there is
Mhm.
absolutely no other way but apart from the private diagnostic players to join hands with the government's initiatives. Now,
Mhm.
obviously, all of us have heard a lot about public-private partnerships, various projects that have come up also, but then
Mhm.
a live example of it is the COVID testing again. So the
Mhm.
numbers significantly were ramped up only when the private players were in the picture, and also
Mhm.
making the tests more accessible. And obviously, if you have abundant capacity, then why not use it more effectively along with the government's initiatives also? But then
Mhm.
again, working with the government is an absolute privilege for private players like myself. But obviously, there are certain challenges that
Mhm.
can only be solved by with a lot of interaction with the government officials. And also we do understand that there are tier 3 cities and smaller villages where quality, accessible, and affordable healthcare needs to go, and we do
Mhm.
need to scale up and also reduce on costing. So obviously there are abundant ways, but the results of these can only come out with effective discussions. And I think more communication, more clarity, more transparency on processes about
Mhm.
actually formulating PPPs is the need of the hour. And there's absolutely no other way that we'll be able to keep this country healthy.
Thanks. Thanks. One thing that is often sort of talked about is I wouldn't say an inherent distrust, but general suspicion that there is around the private sector, right? Uh, in fact, one thing that I must say is that the government's really taken note of that over the past few years. And if you look at all the other initiatives, Ayushman Bharat and all the other things that are happening, there've been some sort of progressive movement, right? Uh, but I think since you're on the other side of that, right, that you are a owner of a private laboratory, do you have any suggestions on how you can maybe reduce some of that distrust or that sort of suspicion that is there generally? Um,
So again, Karthik, I completely agree with you that this kind of a
mhm.
sentiment has come up in the past few years, and even over the pandemic, we saw the oxygen cylinders and the entire scam behind oxygen supplies, and even
Right.
hospitals were in the forefront, even labs doing testing were in the forefront. But actually,
Mhm.
what the people need to understand is
Mhm.
that firstly, that the input cost that the government was also saying repeatedly, that the RT-PCR test these many hundred rupees and the kit costs 400 rupees a test and so on and so forth. That's not actually the cost of the test. That is
Right.
only a small factor of what
Mhm.
goes into what the lab or the hospital or whichever healthcare facility you're talking about. It's only a
Mhm.
small factor of that, and it
Mhm.
has other costs attached to it, not only the manpower costs but the infrastructure costs, the capital that has gone in, also running costs. There are abundant other things that you need to take account of. So I think the correct information going out also is important. Also, another thing, Karthik, it actually amazes me, but the diagnostic industry over the past, I think, 3 to 5 years, because of the lucrative image that it portrays, has completely been commoditized. Obviously,
Mhm.
it's very sad that actually people compare it to actually going somewhere and buying something off a shelf, or actually
Mhm.
compare it to a product. For a lot of people, a report is probably just a paper with some figures on it. But what they
Mhm.
actually miss out, and I aspire to let them know also and understand, is that that simple report that you see is actually going to affect not only your diabetes medication but also the statins that your doctor will put you on after a simple lipid profile test, or the blood
Mhm.
culture report is going to start you on antibiotics. So these are very important things to understand, that when you also talk about price capping and when you also talk about
Mhm.
regulating this, it is the need of the hour. But again, communication and transparency is very important for the government also to understand exactly what are the input costs. I'll give you a simple example, Karthik. Now, the very much spoken about test, that is D-dimer. Now,
Mhm.
this is one test that we've probably learned the most about in the past maybe 6 to 8 months. Obviously, we've
Hmm.
been performing it since years for coagulation, but nothing
Right.
like the way we've done it for COVID. Now,
Hmm.
the D-dimer test is such a sensitive test to run that the transit time or how the sample is collected slash processed can make a huge difference on your test result. I've seen this with my patients. I've seen this with my patients coming to me with comparisons with other labs also. So just as an in-house study, I tried to compare the number of rechecks that we do for a D-dimer. And you
Hmm.
won't believe it that the rechecks for the D-dimers that we were doing, because at one point we were getting so many elevated values that we weren't billing those rechecks to anyone, but we were doing rechecks for say about every fifth or sixth sample, just to be
Wow.
sure that yes, this is an elevated value and we do want to recheck it. And even tests like interleukin 6 etc have to be very carefully calibrated. Any value that is not correlating clinically, or if you see a person where the counts are normal, CRP is normal, I speak to the patient, they say they're doing much better, and your IL-6 is high, you have to recheck it on a parallel instrument and then only give the report. So again, there are a lot of these costs of repeats, rechecks, calibrations, and other things that I mentioned that should be kept in mind.
Thank you. That was a really good example as well, because I think you're right. I think nobody debates that price capping and general reduction of prices is a good thing, but then in that conversation, these nuances get left out, right? That the more quality checks you put, of course, there'll be a cost to that, right? And not every test is same, right? And so I think this is something that for all of us, and hopefully viewers of VOH also take into account, that especially when these policies are being made, those kind of considerations are also kept, right? And the total landed cost of doing a test. It's not just the kit itself, right? It's all the other ancillary services, the salaries you pay, the trainings you do, the quality compliances you have. So thank you. I do want to pivot a little bit because I know you have a keen interest in technology and all the new advancements that are happening, and maybe this is the more exciting part of our conversation. So I'd love to get your thoughts on generally some of the things we've been hearing, that more POC tests, right? We're also hearing off late of some home-based kits, not only for COVID but for certain other diseases as well, right? And so how do you see that? I would imagine that there's certainly certain positives, but there are also some maybe negatives or some challenges to keep in mind. So I'd love to get your thought on some of the new technologies you're particularly keen on, that Dr. Dang's lab is investing in, and so that would be a good way to spend our time for this discussion.
Great, great. So Karthik, again, very relevant. Again, speaking about the vastness of this country and the lack of infrastructure and healthcare facilities in villages and tier four cities, it's very important that we have these point of care devices that can serve as effective screening tools. Now, when I call them screen tools, I only do that because obviously we have more sensitive and more accurate equipment elsewhere as well. But obviously now I'll give an example of either tuberculosis or even COVID-19. We have absolutely very sensitive machines such as the Gene Expert or the Abbott ID or the one that Thermo Fisher's come up with. And these are absolutely incredible because the way that I look at these machines is that they're idiot proof. So what I mean by that is that you don't really need much training. Even a fresher technician, if you give him the proper process and just show them how to do the test, they can perform the test and you can get a result within minutes. Now, the entire discussion around the rapid antigen test, obviously it's not the gold standard. Obviously, when a rapid antigen test for COVID-19 comes negative, you need to repeat it if it's clinically suspicious. But then there's a major advantage. It can be set up in a village. You can test thousands of people in a day. And then obviously the ones that are transmitting the infection, the ones that have a low CT score, the ones that have a high viral load will obviously test positive. They can be immediately quarantined. So the age old saying that something's better than nothing at all certainly is valid in this case because it does help us triage the patients, reduce the burden for RT-PCR, and then also put in place immediate steps to reduce the burden and the spreading of the disease. Now again, looking at other point of care devices, also we have the gene expert for tuberculosis. That's again a pandemic on its own that's been going on for many years in certain villages and smaller towns. Certainly, the gene expert machine, that's again a cartridge based PCR system, can really help you churn out positive results and effective results at a very short turnaround time. So point of care testing, even if it's inside the hospital or a tertiary care center, or if it is somewhere where we have lack of manpower and healthcare expertise, is something that we all need to work towards. Also, I'll give the example of saline gargle testing for COVID-19 that's recently been approved by ICMR. And also, I've been reading and speaking to my colleagues in the West who are doing saliva-based RT-PCR testing. So currently, Dr. Dang's lab is also doing a study with a very prestigious academic institute in the US, where we are actually evaluating saliva samples for RT-PCR testing for COVID-19. So the whole idea behind this is that again, you will actually reduce the manpower burden on the lab to actually go to people's homes and collect the sample. It'll just be the logistics team that will be dropping off these set boxes in which the patient will have the instructions on how to collect the saliva, and they collect the saliva and then it gets dispatched to the lab where we actually run it. So obviously innovation, technology, all of these things will come into play, and point of care devices is something that we are actually a little behind in the West, if you allow me to say that. But we need to inculcate those learnings and also work towards more R&D so that we can have them effectively implemented in the near future.
Thank you. Thanks. I'm looking at the time, but I've been really enjoying this. So and so maybe VOH will allow us to go a few minutes over. One thing that's coming up now is really around pretty much public discourse, and healthcare clinicians like yourselves have been busy with COVID-19 for the past year and a half, right? And rightfully so. But there are all these other epidemics, all these other diseases. You talked about TB, we can talk about hepatitis, other chronic infections that patients have not been presenting themselves, right? They've not been going to facilities. And maybe you've seen that in your own numbers, right? Tests for all these other ailments, they've probably come down from previous years. Do you see the role of the diagnostics industry or labs such as yourselves to maybe really close the gap, because those diseases aren't going anywhere, right? They'll just show up. There'll be pent up demand. They'll show up later. It could possibly get worse. So to viewers listening, to maybe other labs such as yourselves, what is the role you guys see yourself playing there?
Sure. So Karthik, you are extremely correct on this one. Non-communicable diseases is something that's actually the back-end pandemic that's been there and will be here to stay also. And obviously, lifestyle changes and minor adjustments can obviously reduce the burden of these diseases. Again, the most important, I would feel, thing to combat this is awareness. Obviously, reaching out to patients, telling them how to actually effectively put that report that they've got with the HbA1c of 6.2, actually put it to use and make some lifestyle changes, see your physician. And now with so many other options of teleconsults, also so much of IT that is involved, not only with testing, but also reaching out to your doctor, NCDs really need to be at the forefront. Even things like oncology, even other things like metabolic illnesses, even other basic lifestyle diseases, even simple things like allergies, all of these have been in the backseat because obviously people were apprehensive to go out and also do any investigations for this or reach out to their doctor. But moving forward, I feel awareness and more discussions and getting to know these diseases better, and obviously if there's someone looking for help, we always love helping them and giving them the information ourselves. But obviously, I've always felt that the more you train your staff is how you spread the word faster. And I think COVID-19 was a good example of that.
All right. Well, thanks. I'm looking at the time, and I think we're just at time. But this has been a very, very insightful conversation. I will say that I hope we can do this over a cup of coffee and, really do this in person at some point. I know you're a busy person. I know you still have maybe half of the day left ahead of you. So thank you so much. And I do know that this is going live, but they will also post it so that people who've missed the session can see it. And thank you to our viewers as well. So with that, we'll close the session.
Thank you, Kaartik.